Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Anesthetic and narcotic drugs. During surgery, there is an increased potential for arrhythmias when catecholamines are given with Option A. Halothane, fluorane. Option B. Digoxin, lanoxin. Option C. Bupivacaine, marcaine. Option D. Lidocaine, xylocaine. Right answer is Option A. Halothane, fluorane. Arrhythmias are a result of an interaction that can occur with halothane and catecholamines. Other choices do not interact with halothane to cause arrhythmias. General anesthetics potentiate the effects of which of the following drugs? Option A. Depolarizing agents. Option B. Skeletal muscle relaxants. Option C. Volatile liquids. Option D. Inhalation anesthetics. Right answer is Option B. Skeletal muscle relaxants. The effects of skeletal muscle relaxants are potentiated with the use of the general anesthetics. Depolarizing agents do not interact with general anesthetics. C and D are general anesthetics. The most dangerous metabolic side effect of general anesthesia that can occur during surgery is Option A. Hyperglycemia. Option B. Hypothermia. Option C. Hypoglycemia. Option D. Hypothermia. Right answer is Option B. Hypothermia. Malignant hypothermia is the most dangerous metabolic side effect of general anesthesia. Mr. Baltazar will be undergoing surgery with general anesthesia. The client should be given which of the following instructions preoperatively? Option A. Eat big breakfast. Option B. Expect to be incontinent of urine postoperatively. Option C. Double your medication doses. Option D. Expect nausea, vomiting, shivering, and pain postoperatively. Right answer is Option D. Expect nausea, vomiting, shivering, and pain postoperatively. These responses should be expected, and the client should be prepared for them. Food is contraindicated before surgery. Urinary retention, not incontinence, is likely. Medication is more likely to be held on the day of surgery. Geneva is reviewing for her upcoming quiz in pharmacology. She should be aware that local and regional anesthesia act by Option A. Inhibiting depolarization. Option B. Shivering can occur in the absence of hypothermia. Option C. Producing a semi-conscious state. Option D. Inhibiting motor movement. Right answer is Option A. Inhibiting depolarization. When local anesthesia is used, sensation is removed and the area anesthetized by inhibition of depolarization. Choice B is incorrect because the opposite is true. Choices C and D do not occur with local anesthesia. Which of the following statements about shivering is correct? Option A. Shivering is a response controlled by the brainstem. Option B. Shivering can occur in the absence of hypothermia. Option C. Shivering is effectively treated with small doses of naloxone. Option D. Shivering is an uncomfortable, though harmless, effect of anesthesia. Right answer is Option B. Shivering can occur in the absence of hypothermia. Shivering can also appear after surgery. This is known as post-anesthetic shivering. Early signs and symptoms of local anesthetic toxicity include all but one of the following. Indicate the exception. Option A. Tinnitus. Option B. Perioral numbness. Option C. Dizziness. Option D. Hypertension. Right answer is Option D. Hypertension. Manifestations of local anesthetic toxicity typically appear 1 to 5 minutes after the injection, but onset may range from 30 seconds to as long as 60 minutes. Initial manifestations may also vary widely. Classically, patients experience symptoms of central nervous system (CNS) excitement such as the following: circumaural and/or tongue numbness, metallic taste, lightheadedness, dizziness, visual and auditory disturbances, difficulty focusing and tinnitus, disorientation and drowsiness. A preoperative patient receives atropine before induction of anesthesia. The nurse caring for this patient understands that this agent is used to prevent Option A. Anxiety. Option B. Bradycardia. Option C. Dry mouth. Option D. Hypertension. Right answer is Option B. Bradycardia. Atropine, an anticholinergic drug, is used as an adjunct to anesthesia to counter the effects of vagal stimulation, which is caused by surgical manipulations that trigger parasympathetic reflexes, resulting in bradycardia. Atropine is not an anxiolytic. Atropine causes dry mouth and sometimes is used to minimize bronchial secretions. The nurse teaching a client who will receive thiopental pentothal as an anesthetic explains that what common adverse effects might occur. Option A. Headache. Option B. Emergence delirium. Option C. Nausea and vomiting. Option D. Paralysis. Right answer is Option B. Emergence delirium. Emergence delirium could occur postoperatively and is characterized by hallucinations, confusion, and excitability. A client received lidocaine viscous before a gastroscopy was performed. Following the procedure, the nurse places priority on what assessment? Option A. Return of the gag reflex. Option B. Ability to urinate. Option C. Abdominal pain. Option D. Ability to stand. Right answer is Option A. Return of the gag reflex. Because the throat is anesthetized, monitor the client for return of the gag reflex before drinking or eating. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.